Hi, my name is Alex Lesokhin. I'm a medical oncologist specializing in multiple myeloma at Memorial Sloan Kettering Cancer Center in New York City in the United States. And so today I'm going to be talking about combinations being evaluated with BCMA CD3 bispecific T-cell engagers. These agents as a whole have already shown significant promise as single drugs in patients with relapsed refractory multiple myeloma. Of course, responses, although they occur in over 60% of patients, can still be further improved. And so the combination approaches are several. One class of combination approaches is using bispecific T-cell engagers that target other targets on multiple myeloma. And the one that has had the most clinical data thus far is another bispecific against GPRC5D. So this is a GPRC5D CD3 bispecific called talquetamab that has been combined with BCMA CD3 bispecifics and has shown pretty impressive single-agent activity and also encouraging activity in patients with extramedullary disease, a type of myeloma relapse presentation that is a major challenge therapeutically. Other bispecific T-cell engagers against FcRH5 are also being combined with BCMA CD3 bispecifics. These are in early phase studies that have yet to be reported. Combinations evaluating traditional myeloma drugs that are already approved and routinely used include combinations with anti-CD38, with daratumumab, combinations with immunomodulatory drugs like lenalidomide. And in fact, some of these combinations in the early phase setting have shown really significant responses or really strikingly good responses in patients in earlier stages of disease as part of inductions. The MRD negative rates approach 100% in combination with BCMA CD3 bispecifics and IMiDs and anti-CD38 in the frontline setting. Additional newer generation immunomodulatory drugs, CELMoDs, iberdomide, and zigdomide are also being evaluated with BCMA CD3 bispecifics. And proteasome inhibitors, some early data with carfilzomib in combination with a BCMA bispecific. Elranatamab has shown pretty encouraging combinatorial activity in the early relapse setting, 1 to 3 prior line setting. Now, there are other more exploratory combinations that for which data thus far is limited. These include combinations with other immune agonists or immune, I would say, checkpoint blockade drugs. For example, PD-1 blockade, LAG-3 blockade. These are all sort of potentially being investigated, but data is still yet to be reported. And finally, combinations that enhance the target levels on myeloma cells. So these are the combinations with gamma syncretase inhibitors that can reduce the amount of soluble BCMA shedding and increase BCMA expression on plasma cells, thereby potentially improving the efficacy of BCMA CD3 bispecifics are also being explored. And data on these will likely emerge in the coming months and years. And so that really just forms the current landscape of combinations, again, with traditional, already approved myeloma agents, with other T-cell engagers or bispecific agents, and finally with agents that further modulate immune response or BCMA expression on plasma cells.